As of October 2023, there are two recommended vaccines against malaria: the RTS AS01 and the R21 Matrix M. Malaria, a life threatening mosquito borne disease caused by the Plasmodium parasite, continues to be a global health concern. This is particularly more severe in sub Saharan Africa, where more than 95% of the 200 million malarial cases and half a million deaths happen. Despite decades of research and control efforts, malaria remains a significant public health challenge, causing quite a number of deaths each year, mostly among children under the age of 5. The development of effective malaria vaccines has long been a goal in the fight against this deadly disease. In recent years, significant progress has been made with the approval of two malaria vaccines, RTS AS01 and R21 Matrix M, offering a brand new arsenal in the battle against malaria. RDSS AS01, commercially known as Mosquirix, and what I'll refer to as the RTS vaccine, is the world's first malaria vaccine to receive approval. Following pilot programs in Ghana, Kenya, and Malawi several years back, it was finally recommended for use by the World Health Organization on October of 2021, specifically for countries with moderate to high transmission of Plasmodium falciparum. The development of the RTS vaccine was a landmark achievement in the field of malaria research. It specifically targets the sporozoite stage of the Plasmodium falciparum parasite, the most deadly of the malaria parasites affecting humans. The RTS in the name refers to the recombinant fragment of the circumsporozoite protein, or CSP, a protein found on the surface of the sporozoite, plus a surface antigen of the hepatitis B virus. The AS01 is a synthetic liposomal adjuvant used to increase the immunogenicity of the vaccine, that is, to make the RTS component more effective. The vaccine works by triggering an immune response in the host, producing antibodies against the CSP. When an infected mosquito bites the host and injects into the bloodstream Plasmodium's infective stage, or the sporozoite, the antibodies can then neutralize the sporozoites before they get the chance to enter the liver and start the exoerythrocytic stage of the life cycle of the parasite. This in turn reduces the risk of the erythrocytic cycle, which is the main cause of clinical malaria. The effectiveness of the RTS vaccine has been a subject of ongoing research and evaluation. Clinical trials in various African countries have shown varying levels of protection. In some trials, the vaccine demonstrated moderate protection of up to around 56%, especially in young children. However, the level of protection waned over time, and the vaccine was found to be less effective in older children and adults. The implementation of the RTS vaccine programs have faced several challenges. Ensuring widespread access to the vaccine, especially in remote and underserved regions, is an ongoing logistical challenge. Additionally, the need for multiple doses and booster shots, possibly due to the waning efficacy, poses challenges in terms of compliance and maintaining vaccination schedules, especially in areas with limited healthcare infrastructure. Furthermore, the effectiveness of the vaccine varies across different regions and different age groups, making it necessary to carefully target its use. Supply issues are also a problem. As of July 2023, through the efforts of WHO, Gavi, the Vaccine Alliance, UNICEF, and other international organizations, 18 million doses of the RTS vaccine will be distributed to 12 African countries. But it is estimated that the demand for malarial vaccines will reach around 60 million in 2026. R21 Matrix M is another promising malaria vaccine that was recommended by the World Health Organization just in October of 2023. The R21 Matrix M, or the R21 vaccine, is a protein subunit vaccine similar to the RTS vaccine. It targets the same circumsporozoid protein, or CSP, but uses a modified hepatitis surface antigen. And its adjuvant, matrix M, is a bifunctional matrix of the influenza virus. Like the RTS vaccine, the R21 vaccine also aims to trigger an immune response against the sporozoid stage of Plasmodium falciparum, preventing the parasite from infecting the liver and causing clinical malaria. Early clinical trial results for the R21 vaccine were promising, showing high levels of efficacy of up to 77% in preventing malaria infection in very young children in a study conducted in Burkina Faso. While the R21 shows promise, it also faces challenges similar to those encountered by other malaria vaccine candidates. These challenges include the need for large scale production, distribution, and cost effectiveness. And as with any other vaccine, ensuring equitable access to those most at risk, particularly in resource limited setting, remains a significant challenge. Malaria remains a global health threat, especially in regions with limited access to healthcare resources. The development and approval of malaria vaccines like RTS S, AS01, and R21 Matrix M represent significant milestones in the fight against this deadly disease. While these vaccines offer hope and the potential to reduce the burden of malaria, challenges related to their effectiveness, distribution, and cost must still be addressed. There are still a lot of other antimalarial vaccine candidates in the pipeline. I'll try to keep you updated once there are further developments. Cheers!
At 29 and I find myself wondering what did happen to the last 10. I ran away with my life, fast forward, never turn